I almost didn't recognize it without the headset.
Well, that's a lovely color. Hello, everybody. Welcome to Ask Doc Live. I hope you are having a fabulous day so far. My name is Becca Dukes, and I will be your host for the next 2 hours of this resource that is being brought to you by AskDocLive.com. Now, if you were invited to watch this program, whether you're here live with us or watching the replay, please make sure that you get back with the person that invited you to watch this program, because they cared enough to share it with you. And they probably have their own special way of making sure that they get the products, and they'll share that way with you. So on behalf of myself, again, Becca Dukes, and my co-hosts, Ruth Ellen Sanchez, Dr. Judy Reynolds, Heather Bowen, and Jonty McCollier, we are excited to have you here with us. So make sure that you have that chat turned on for those of you who are on live with us. And also, if you have a question for Dr. Wallach, find the option to raise your hand. I will be calling on people in the order that their hands are raised. In the Zoom menu, if you click on participants or reactions, you will be able to find in either of those places an option to raise hand. So we want to make sure that we get a variety of questions answered and make sure that the things that matter to you most are heard on this program. Now, I do want to remind everybody that the content of this program is to provide educational information only on the importance of nutrition, and it says supplementation, but it's actually essential factors, folks. You'll hear about that in the show today. And the reason why we want to make sure that you are getting this education is because our food supplies around the world, not just here in the States, but around the world, are empty and void of what the body needs, not just to survive, but actually thrive without pain and disease, or limited pain and disease, depending on where you are in life. In this program, we will be sharing nutritional options that are available to fill the gaps through the supplementation in a form that the body can readily absorb and utilize, and also synergistically blend it so that you keep a balance that is healthy for the body. Now, these statements have not been evaluated by the FDA. The products discussed are not intended to diagnose, treat, cure, or prevent any disease. And the information in this Zoom, again, is for informational purposes only. If you are pregnant, nursing, or taking medication, please consult your healthcare professional before starting a supplement program. In our products, we use food as medicine, folks. So rest assured, you're not getting any chemicals. Now, I had mentioned that this program is not meant to take the place of your primary care physician. Our good doctor, Dr. Joel Wallach, has been instrumental in suing the FDA 9 times with, well, it's more than 9 times, but 9 victories, folks. And these victories have led to the addition of vital nutrients that are now added to foods to allow the distribution of the information proven by science. Okay, it's not just somebody's thoughts, but it's proven by science to be factual in the essential need of supplementation against disease. Now, many have been told that they are experiencing a genetic condition, and there's absolutely nothing that you can do for it. Well, we are bringing good news, because there is a theory that has proven the genetic theory. Actually, it's the science that has proven the genetic theory incorrect, and that's the science of epigenetics. Now, epigenetics is the study of how your behaviors and environment can cause changes that affect the way your genes work. With epigenetics, you are an empowered individual, and you have more control than you think over your own health journey. U-turns are welcome here, folks. We invite you to feel the difference with the options shared on this program. Now, any testimonials that are shared are that of the individual. We do not solicit testimonials, but if you have a testimonial using the 90 essential nutrients, you are welcome to share. And to guide us on this journey of finding and creating better health, we are honored to have one of the founding fathers of epigenetics here with us each and every Friday, sharing the best options to obtain or maintain optimal health. Dr. Joel Wallach. Welcome, Dr. Wallach.
Well, thank you, Rebecca. Thank you, team, for being here. I just appreciate you every Friday, devoting your time to making sure the information gets out there. And it's an endless process. It's something we have to do constantly to make sure that the information does get out. Now, with that said, you have to appreciate that the medical science is way behind on this. Their belief is that everything is genetic, everything is autoimmune, and so forth. And of course, none of that's true. The genetic thing came about in the year 1900, when suddenly there was like 45 new diseases nobody had ever seen before. And those 45 new diseases were caused by nutritional deficiencies in the embryos. Now, you have to appreciate that the embryos require an enormous amount of nutrition. The embryo starts out with a sperm fertilizing the egg, and in a period of 9 to 10 months, the baby's born. And in that 9 to 10 months during the development in the mother's uterus, the baby requires an enormous amount of nutrition and I'm talking about not calories, I'm talking about enormous amount of vitamins and minerals to make sure that the developmental process takes place properly. And so all the organs are formed completely. And so when there are deficiencies, in the beginning, babies are born with one or more birth defects, heart defects, brain defects, muscle defects, liver defects, lung defects, oral defects, cleft palate, that sort of stuff, spina bifida. All these things are caused by nutritional deficiencies. Now, when the baby's born, the birth date, the baby's already 9 to 10 months old, almost a year old, okay? And so I give the babies credit, everybody says, oh, my birth date is such and such, and that's when my life began. No, your life began 9 to 10 months before that. And if mama was not taking the 90 essential nutrients for at least 6 months before conception, if the father was not taking 90 essential nutrients for 9 to 10 months before conception, guess what? There's a risk that baby is going to have a birth defect. And many babies are born with 2 and 3 and 4 and 5 different birth defects. And this is when people would take the option. That's why they developed the scans and everything to look at the embryos. And they say, oh, I got 18 birth defects here. And the mothers would choose to do a abortion. Well, all that could have been prevented if the OBGYNs would have done their job and make sure that these young mothers and fathers had a class like every week available to them. And, you're starting to cycle, you better come to this class and know about taking these 90 essential nutrients so you can prevent birth defects and so on. And the need for abortions would have been reduced significantly, because most abortions are performed at the request of the young parents because the baby has one or more serious birth defects. Everything from Down syndrome to heart defects, brain defects of all kinds, cerebral palsy. There must be a dozen different heart defects. And then there's birth defects such as, let's see here, cystic fibrosis. I'm the guy who found the first non-human case of cystic fibrosis and got it documented. And it freaked everybody out when I told them, because they all agreed that the slides I was sending was from somebody with cystic fibrosis. And I told them it was from a rhesus monkey at the primate center at Yerkes in Atlanta, Georgia. I was working for NASA as a pathologist. And so I got credit for finding the first non-human case. And I said, well, at the very least here, we have a animal model to study it. And they were excited about that. And then, of course, after I became very expertise at the thing with cystic fibrosis, I told them it wasn't an agenetic thing. It was due to a nutritional deficiency early in pregnancy, and they fired me from Yerkes Primate Center. It wasn't the pathologists that fired me. It wasn't the space guys that fired me. It was a bunch of behaviorists who were in charge of the animal colony who fired me, because they didn't want to believe it, because they were tinkering around with the diet, and they screwed up the diet. That's why all those babies, 24 of them, had cystic fibrosis. And then, to make a long story short, after many years of being a naturopathic physician, I was working in Utah and Idaho with one of our great distributors, who's a U.S. Marine, Marvin Ropp, and we were actually reversing muscular dystrophy in the kids there. And we gave about a half a dozen charts to Jerry Lewis, and he had spent 50 years and raised $2.7 billion for the Muscular Dystrophy Association. And they're trying to find the prevention and cure. Well, we found it. And they fired Jerry Lewis and shut down the telethon after 50 years and $2.7 billion of funds raised, because they didn't want to hear that it was not a genetic thing, which is what they falsely believed in. And then, as a sort of thing that we got, what should I say, as an add-on, we weren't going that direction. People always heard of the sudden death syndrome, was caused by mothers laying on the babies in the bed and suffocating them. Now, this is how outrageously dumb the doctors are. And this is why I came up with the book and the CD entitled Dead Doctors Don't Lie, because that's sudden death syndrome thing. And doctors believed it was caused by mothers laying on the babies and suffocating them. Well, it's just hypertrophic cardiomyopathy heart disease, a simple nutritional deficiency that causes a sudden heart death. There's been 3 young athletes, 24, 25, 26 here in the last couple of weeks, who died of that. 500 to 1,000 young athletes in America die each year from sudden death syndrome. But they're 25, 30 years old, 18 years old, 12 years old. But it all comes down to hypertrophic cardiomyopathy heart disease, a deficiency of a single nutrient. And so, as Rebecca pointed out, we were fighting in court, for 25 years. A great attorney, Jonathan Emord, and we petitioned and sued and petitioned and sued and petitioned and sued. And we finally won and got the nutrients put in the infant mills. Doctors were blocking it, saying these nutrients are dangerous nutrients in baby food. They'll kill the babies. So we finally got it done. And within 9 months' time, sudden death syndrome went away, cystic fibrosis went away, and muscular dystrophy went away, because we had gotten these nutrients put in the baby formulas. And so, and the rate of Down syndrome has significantly been reduced. Now, there's always going to be a few sneak through, because the mothers are not taking the 90 essential nutrients, and they're breastfeeding. They think, well, I'm eating well, and the baby's getting everything from my breast milk. That's all I need to do. And so they're still deficient in that nutrient. Or maybe they're just giving them some cow's milk off the shelf, or pet milk, in the can. And they might be giving them a little bit of baby vitamins, but that's not enough, Plants do not manufacture minerals. Plants can manufacture vitamins, amino acids, and fatty acids, but plants cannot and do not manufacture minerals. Nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. And the only way you're going to guarantee that you're going to get all 60 essential minerals is to consciously, proactively take them every day, And especially, if you're in the childbearing years, whether you're the girl or the boy, both are important, 50%, 50-50, And so, because doctors had kind of control over the helm, if you would, for many years, we ranked, let's see here, we ranked 54th in the world when it comes to life expectancy, 75. We live to be 75 on the average. There's 53 other countries whose peoples live longer than we do. But we have the best healthcare system in the world. No, we don't. We got the most expensive healthcare system in the world, but not the best. Let's see here. The Philippines life expectancy is 71. Australia is 82.9. New Zealand is 82.3. Japan is 84.7. Canada is 84. China is 76. UK is 81. UK is England, Ireland, and Scotland. Russia is 72. South Africa is 63. Mexico is 77. Italy is 83. Ukraine is 71. Let's see here. Spain is 82. Germany is 81.26. I thought that was kind of funny. And then Hunza has the longest life expectancy. They rank number one in life expectancy in the Himalayan mountains. This is 120. And many live to be 130, 140, 150, 160. Okay, and it has to do with all the minerals that come from the volcanic ash and the glaciers and so forth. And it's one of those things where it's a constant, okay, and these numbers have been going on for a long time, okay? And so what can I say? It's one of those things where we have to take control here. And of course, we have paid a price. We have paid a price in years and also money. Alzheimer's disease, which was diagnosed at first 1960, Alzheimer's disease, it wasn't the first dementia. You know, there's senile dementia and all that kind of stuff. But Alzheimer's disease is a very specific disease. It's a loss of myelin, which is a white matter, the insulation material in the brain and spinal cord. And we're spending $305 billion a year just to treat the symptoms of Alzheimer's disease, and projecting before the end of next year, it's going to be over $1 trillion a year just to treat the symptoms of Alzheimer's disease. Arthritis is $626.8 billion just to treat the symptoms. And when you throw in osteoporosis really makes it skyrocket. And I couldn't find a study just on how much we spend for osteoporosis in the United States just to treat the symptoms. So I found an article that showed the USA, Canada, and let's see here, Europe. Okay, we spend $6,500 billion a year just treating the symptoms of osteoporosis. 6,500 billion. And so let's say we're a third of that. So that means we're spending $2,150 billion dollars each year just to treat osteoporosis in America. Holy moly. Diabetes, 342 billion per year just to treat the symptoms. Heart disease, dozen different heart diseases, $316.8 billion just to treat the symptoms of heart disease. And then obesity, 210 to 260 billion. High blood pressure, 131 billion to treat the symptoms, not to prevent it or cure it. MS, multiple sclerosis, that kind of goes along with Alzheimer's disease. MS is a disease that we've known about for about 100 years. And we spend $85 billion a year just to treat the symptoms of MS, multiple sclerosis. In kids under age 25, it's called Guillain-Barré syndrome, named after two French doctors from 1916, Dr. Guillain and Dr. Barré. And MS is a loss of the myelin, the white matter of the brain and spinal cord. Okay, and you can have that and Alzheimer's disease all at the same time. And so we're adding to the book, It's All in Your Head. We're adding MS to that. And so Rebecca and I are putting together a CD, and it'll be the CD for a while until we get down to low numbers. We'll be able to then reprint the book. It'll be a printed new chapter in there. Right now, there's 25 different diseases in the book. It's All in Your Head. And we will throw in another one, so it'll be 26 diseases when we reprint it. But in the meantime, we'll have the CD to go along with the book. It'll be the last chapter in the book. Very, very excited about that. And then let's see here. Asthma in kids under the age of 10, we spend $80 billion a year just to treat the symptoms of asthma. It's a very simple nutritional deficiency. We can get rid of it in weeks. I don't care if they've had it for 20 years, we can get rid of it in weeks. Then same thing with kidney failure and dialysis. We spend $24 billion a year on dialysis, which is just treating the symptoms of kidney failure. And we get people off of dialysis all the time, okay, because we know what the basic root cause of kidney failure is. And so when you deal with that, give them the 90 essential nutrients and get them off the bad foods and so on, kidney disease goes away. Okay, it's really very simple. And so this is why we are here. We are here to share this information. Don't forget that book, Dead Doctors Don't Lie. The CD, Dead Doctors Don't Lie, is in 9 languages. And we've sold over 600 million copies of that in 9 languages. And the book, It's All in Your Head, is going to, I think, surpass that, because doctors never talk about osteoporosis of the skull. Of course, they have all these specialties: dentists, hearing aids guys, neurologists, vision people, psychologists, people who deal with birth defects and so forth. And all these are caused by nutritional deficiencies. Okay, and so it's all preventable. In some cases, in most cases, it's reversible. Now, there's some places where, you get a birth defect with a cleft palate that requires surgery. You get a heart defect. Sometimes they're fixable with surgery, and sometimes they need a heart transplant. And so, it's better just to make sure that everybody's getting their 90 essential nutrients and avoiding the bad foods to maximize absorption. And we can reduce this by right now. For instance, it's here. Let's look at one of the big ones here. Let's look at sudden death syndrome. Sudden death syndrome. Okay, right now, well, let's go back to 1990 when it was sudden death syndrome. We would have 135 to 140 sudden death syndrome deaths per 100,000 normal births in America. Today, it's 15 to 20 per 100,000 births. We've reduced it by 95% or more, 95 to 97%, by putting these nutrients into the baby formulas. And you don't hear about sudden death syndrome anymore. Now, maybe 1 or 2 cases will happen a year because the mothers are breastfeeding and not taking the 90 essential nutrients, or they're giving the baby, pet milk or something like that without the 90 essential nutrients. And that's why we came up with the Kids Toddy. You can add the cherry mints to that. You can add the EFAs, and you'll have a great program to add to the baby. Even if the baby is being breastfed, at least 1 meal a day, you want to do the Kids Toddy. Okay, with that, I think we've kind of laid open a wide variety of potential questions and everything. Diabetes is easy to get. Type 2 diabetes, which makes up 98% of the diabetic population, is easily gotten rid of. It's not a genetic disease in any way, shape, or form. It's a simple nutritional deficiency disease, and we can get rid of it. Do you want to keep giving yourself shots of insulin every day? Or do you want to go back to a wonderful life? I think that was a wonderful movie.
It's a wonderful life. Yes. Yes. Well, Dr. Wallach, that's a great opening for one of my first questions. And that has to do with MS, myotonic muscular dystrophy. And it's in a set of twins. So we know from you that nothing is genetic.
That's correct.
And one thing that I really want to emphasize here, especially for mamas who have lost children to sudden infant crib death or any of these things that are, blamed on the mom, it is not your fault. Okay. And as Dr. Wallach mentioned on some of these conditions, it's your OBGYN's fault that he was not making sure that you were getting the nutrition. And let's even go back to the MD prior to that, because you usually don't see the OBGYN until you're 3+ months pregnant. How about that doctor that was supposed to be making sure you were getting what you needed to stay healthy? And that's what this program is all about, is making sure that you're getting information that you're not going to hear in a doctor's office. And Dr. Wallach, I think we really need to make a campaign in pushing that pre-pregnancy nutrition, and then during the pregnancy and post-pregnancy, because so many things happen within the body that when the body is not supported nutritionally, a lot of things can go awry. And those things are.
Rebecca, can you imagine a human being coming from 2 cells, 1 cell from the mama, 1 cell from the dad? Half the cells in that embryo, which is made out of half the cells are from the mother and half the cells from the dad. And so if there's any one piece missing, that baby is going to be in trouble. And so, you know, when I was in school, they used to have in high school and preschool and school, they used to have classes. I think about the 5th grade. They call it a health class. And they would teach you about, you know, healthful living and, you know, avoiding alcohol and all that kind of stuff. And they would say, you know, you make sure you're eating right. And then they would move on. They wouldn't spend much time about individual nutrients and what deficiencies that are caused by nutritional deficiency, that one nutrient or anything like that. So the kids didn't put a big thing on it. Well, I'm eating okay. Okay. You know, I have eggs for breakfast. I have meat for lunch. I have meat for dinner time and so forth. They thought everything was good. Well, it's a little bit more detailed than that. And so I think we need to force as part of their curriculum to be licensed in a state. Doctors must volunteer their time to give lectures to these 5th grade students for an hour once a month, okay, to make sure they're getting all 90 essential nutrients to prevent the birth defects. I think I'm going to start pushing for that. We need to make sure to, as part of the licensing requirements, they have to donate an hour each month to giving lectures in schools to make sure that these young kids are taking their 90 essential nutrients to avoid the birth defects.
Yeah, it's so important. And, you know, I remember 5th grade having that one semester of health, and it was more on fitness and, you know, the parts of the body, not so much nutrition and what keeps that body running, other than that pyramid that has changed so many times in my lifetime as to what we should be eating, where it was 4 categories and there are 7 categories. And Dr. Wallach, today, there is so many trains of thought in demonizing meat. And the proteins that are found in vegetables are not the proteins that are going to support muscle growth.
Yeah, and of course, it's one of those things where it's not the meat that's causing the problem, it's how you cook the meat. Okay.
Yeah.
We don't want air fried. We don't want deep fried. We don't want pan fried. Okay. We want roasted, medium rare. I have steaks 2 or 3 times a week and they're medium rare. If they're medium or medium well, guess what? They go to the dog.
Yeah, you don't eat them. You know, that's overcooking and killing the nutrition and creating that conversion of molecules, taking something that's really good for you and making something that is more toxic. And we want to make sure that we have in our environments, not just our food, but in our environments, non-toxic living.
And you look at the cultures that live a long time. They eat a lot of meat. Okay, but they don't eat wheat, brown, rye, or oats. They tend to eat like Asians. They tend to eat a lot of rice and sweet potatoes and stuff like that for their carbohydrates. And of course, by dumb luck, many of them, you know, live near volcanoes and they have a lot of volcanic ash in the soil on a constant basis. And that's all part of the deal. And so unless you're going to fertilize your whole field, you better be taking those 90 essential nutrients orally. Okay. And I've been doing it twice a day for 75 years. And most people think I'm in my 50s when they look at me. They don't realize I'm 83. And it's one of those things where most people will be hard pressed to keep up with my schedule. And so it's one of those things where this is well documented. We know this from animal research over and over and over and over. We don't have health insurance for animals. We have life insurance for expensive racehorses, okay, which we were talking about earlier before we started today. But we don't have health insurance. And so the farmers had to learn. I mean, I can tell you, Muscular, you can go to any 4-H member, you know, who may be in 6th, 7th, 8th grade and ask them, what's the cause of white muscle disease in calves? And they'll tell you right away the nutritional deficiency that causes white muscle disease in calves. Well, what's the disease called in human beings? It's the same disease as white muscle disease in calves. It's called muscular dystrophy.
Well, it is called muscular dystrophy, but if you were to ask somebody that, they would not know, Dr. Wallach.
Oh no! If you ask the farmer, what causes muscular dystrophy? They'll just say, oh, it's genetic. But if you say, what causes white muscle disease in calves, they'll tell you that nutrient.
Exactly. Thank you for clarifying that. Yeah. Well, since we're talking about muscular dystrophy, Dr. Wallach, I have a mama who has written in, and she has a set of twins that are now 29, both of them diagnosed with myotonic muscular dystrophy. Her daughter has symptoms of muscle tightening. Her strength has decreased in her hands. And when she was 16, she had a severe deficiency of vitamin D that they found out from the endocrinologist. And she also now has problems with fertility. The son has lost his muscle from his shoulders down and in his calves. So he has decreased strength as well. He still walks, but having trouble. They're searching for someone that can help them with this condition. Regular doctors just tell them that it is genetic and there's nothing they can do to stop it. The son has even gone to Duke University, but they give them no advice, Dr. Wallach, not on nutrition or anything to help them. She saw your information and how the specific nutrient helps with the disease, but she wanted to, and that was from a video of you from our program, but she wants to know, what all can I get for my children to stop what's going on with this horrible disease, Dr. Wallach?
Okay, the twin boys and also the daughter and the mom and everybody else.
One daughter, yeah, one daughter, one boy. That's the twins.
Oh, so they're okay. They're not two boys. That's somehow I thought it was two boys.
Nope, one of each.
Okay.
She got blessed.
Okay, so everybody in the family, mom and dad and the twins and any other kid in the family, grandkids, everybody needs to get rid of the bad foods. No fried foods, no processed meats, no oils. No, when I say no processed meats, I mean no ham, no bacon, no bologna, no salami, no pastrami, no pepperoni, no jerky, no corned beef, none of that kind of stuff. Okay, those are the chemicals that are in there. Then they need to stay away from oils. We're talking about salad dressings and cooking oils. No frying, no air frying, no dry, no deep frying, no pan frying, no frying. And then absolutely no gluten, no wheat, no barley, rye, and oats. There are no such things as gluten-free oats. The gluten in oats is called gliadin. And people who are really bad people take advantage of that and say, oh, I've got some gluten-free oats. No, it's still gluten. It's just a different name. Okay. A projectile being shot out of a bullet is still going to kill you as well as a bullet, right? And so it doesn't matter what it's called. If it's bad, it's bad. And then they need to also stay away from sugar, no added sugar as much as possible. You're not going to be able to totally stay away from sugar, but you want to really consciously don't be putting 2 teaspoons of sugar in your coffee in the morning and that kind of stuff. And then also they need to stay away from carbonated drinks. Even the diet drinks got to go, because the carbonation neutralizes stomach acid, so you cannot efficiently absorb minerals or digest food. So you need to get rid of all the carbonated drinks, even the diet ones. Then everybody needs to get the 90 essential nutrients. And when you have this history of problems, I'd go with a bigger hammer. I'd go with the 215 nutrients, which is our Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. If they weigh 140, 150 pounds, I'd go with 2 Healthy Brain and Heart Packs per month, a full dose of everything twice a day. And then I would also throw in the MSM, get 2 bottles a month, so they can take 3 at breakfast, 3 at lunch, 3 at dinner time, and they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between a vertebrae, bone, makes a bone itself. You also need to take the collagen peptides, a scoop of that in the morning drink, a scoop of that in the evening drink. It will help rebuild all connective tissue, including the skin and bone marrow and stuff like that for the immune system. And then they need vitamin D3, 3 of those twice a day. That's 2 bottles a month. And I would also be taking let's see here, they need to be eating 3 eggs twice a day with soft yolks. Oh, what about cholesterol? Cholesterol. Well, cholesterol is your best friend. First of all, it makes up 95% of the weight of testosterone and estrogen. Okay. Secondly, the cholesterol makes up a significant portion of the white matter, the myelin of the brain. So when you have, that's why Alzheimer's disease came along in the 1960s, because when they came out with the statin drugs to lower cholesterol, because they blamed plaque in the arteries on cholesterol, which is not true. It's really due to salad dressings and cooking oils and fried foods. Okay, but they blamed it on cholesterol, and everybody started selling cholesterol-free products and so forth, no eggs and egg beaters and stuff like that. Okay, well, this is where you need to go back and eat 3 eggs. I eat 3 eggs twice a day. Preferably, you want to eat them soft, okay? Soft yolks, preferably. And then also, I want people to be sure that they're taking, let's see here. I would also take care of the Zera test for women. They could take 3 of those twice a day. That's 2 bottles a month. Excuse me, Zera test is for the males. I'm sorry, it's for the males. And Zerafem is for the females. Take 3 of those Zerafem twice a day for the females and Zera test twice a day for the males. Don't forget the 3 eggs twice a day. And they're going to be able to make all the hormones necessary. Okay. And of course, they need to keep doing that. And when a doctor says, oh, don't waste your money on all those vitamins, minerals, just eat well, use the 4 food groups and the 7 food group pyramid that Rebecca was talking about earlier. Okay. This is why we have so many birth defects. And this is why the abortion thing became so important to, which I say to the cultures on earth that didn't have so much money, and they weren't consciously buying all the vitamins and minerals and everything. They were just, quote, trying to eat well. And they had some women would have babies, embryos with 3 and 5 and 8 and 10 birth defects. And so they opted for an abortion. Okay, well, if they'd have been taking the 90 essential nutrients for at least 6 months to a year before conception, the odds are they wouldn't have those birth defects. There's going to be some exceptions if they're eating, gluten and that kind of stuff and not absorbing the nutrients. And so, there's many pieces here. And so that's why they have oil filters, in cars, and they have the liquid windshield wiper fluid reservoirs. They have heavy grease for, your heavy duty bearings and things in the car engine. And then, of course, gasoline. You don't just put dirt from Texas or Saudi Arabia in your car. You put specific chemicals in the car. You need to do the same thing for yourself and the people you love. Now, it's not too late. Remember, I'm the guy who got rid of cystic fibrosis. I'm the guy who got rid of muscular dystrophy. I'm the guy who got rid of sudden death syndrome. You don't hear about them anymore. And so, a few sneak through, but that's because the mother was not getting good advice from the OBGYNs, her doctors, her general practitioner, her science teacher, whatever. And the baby paid the price. Okay. Now, some things, like cleft palate are going to require surgery. Spina bifida is going to require surgery. There's some things like heart defects might require heart surgery, maybe even a heart transplant. Okay. And so you really, really, really want to pay attention to these details. It'll save your family an enormous amount of unnecessary misery. It'll save your family an enormous amount of money and add many, many healthful years to their life. So I hope that was kind of a long roundabout way to say it, but I think that answers your question.
It does answer the question. And Dr. Wallach, since there is so much muscle loss, I know we have a product called HGHU complex, which has those additional amino acids to help support muscle. Would that be one that you might add to that protocol?
Yeah, you could add. Okay, the HGH actually is not only good for the muscle, but also the hypothalamus and also the pituitary gland and so forth. And I take 3 of those HGH twice a day. I take 3 of those twice, a big bottle. And so one big bottle, you'll be able to get, I would say, a good month and a half out of that one bottle to take 3 twice a day for an adult HGH. And you have to appreciate there's many, many reasons why you want to do that. Your hypothalamus, the part of the brain that controls, hormone production and all that kind of stuff in the brain with the pituitary gland and so on, controls who you're going to chase for sex and who you're going to allow to chase you for sex. So most of these gender issues are due to nutritional deficiencies that cause a lack of function of the hypothalamus and the pituitary gland. And so that's why we came out with the HGH. Gosh, it's got to be 12, 15 years ago. And so when families have a little kid, who are 5 and 6 years old, and it's a little boy, and he comes back from school and he says, "Mommy, I want to be a girl." You want to get him on the HGH and get him on eggs every day, as well as, get rid of all the bad foods and everything like that. And you may be able to alter the future. Okay. But if there's really a significant damage to that hypothalamus and the pituitary, that's where the gender issues come in. This is not a choice. This is not something a kid just decides, well, I'm going to be a girl. I'm going to be a boy. No, they don't just decide that. It's because of a biological malfunction, because of a nutritional deficiency prior to them getting into puberty.
And we love them where they're at, how they are, and we support them to be the best that they can always be.
That's why we love them.
Emotionally, it's across the board, folks. We are all unique. We all have our own special everything to bring to the table to make this a better world. Well, Dr. Wallach, that's a lot of information on MS, and thank you so much for sharing that. I know this mom is going to be very beneficial in being able to take this information and share it with her adult children so that they can start leading a different life physically.
Yeah, not only for themselves, but also their children. They don't have to lay awake at night thinking they're dealing with a genetic disease. It's not genetics.
No, absolutely not. It's not something that has to be carried on through the generations. Well, Dr. Wallach, let's go to the first hand that is up. And Vicki, go ahead and unmute yourself. You are on live with Dr. Wallach.
Hi, Dr. Wallach and Becca. I'm Mike. I'm Vicki's husband, and Vicki's been following you all along, and she's got a lot of your the vitamins that you're taking. I'm 65 years old. I'm 6 feet tall, weigh 259 pounds. I do have high blood pressure. I take a medicine for that, and I take Wellbutrin for my ADD.
Okay. All right. Any other issues? Any diabetes? Any aches and pains in your joints? Anything like that?
Well, I do have. I've been diagnosed with carpal cubital tunnel syndrome, and I do have osteoarthritis in my right knee. It's bone on bone. I do a workout. I work out with weights, and I do spin. The spinning helps my knee because it lubricates it. And I have started the 90 Essentials that my wife has, but the problem is I don't think I'm taking. It says I should be probably taking more than I'm taking. I just started 6 this morning, but I was taking 4. And she has the pills right now, and then she'll go to the powder. She bought the powder too.
Okay, well, I have to appreciate the BTT 2.0 tablets are not vitamins and minerals. They are there to help relieve pain and inflammation. You're not getting the 90 essential nutrients when you're taking the BTT 2.0 tablets. They're not an exchange. They are not an exchange for the powder.
Okay. Yeah, because
Okay.
I'm thinking it's the orange bottle. It says tangerine tablets.
Yes, that's not an exchange for the powder.
Okay.
Oh, it's not.
It's not.
Third time, it's not an exchange for the powder.
We got you. So got to get the powder. Okay.
You got to get the powder. Okay. Now,
Yes, sir.
again, the tablets, I take those and the powder because the tablets are for relieving inflammation in the joints and support the immune system and all that kind of stuff. But it has nothing to do with the 90 essential nutrients.
Okay.
Now, why they named it that, I don't know, because it confuses people. So I apologize for that.
That's right.
Now, okay, so here's what I would do for you. You need to get rid of all the bad foods. No fried foods, no processed meats, no oils, no gluten, no wheat bar granules, no sugar, no carbonated drinks. Even the diet one's got to go. And you should not have a cheat day. You cannot work in a bakery. You cannot do your clothes in a laundromat because you're going to get cross-contaminated from gluten in the laundromat.
Okay.
All right. Then at 259 pounds, right on that cusp, if finances are not an issue, I would take 3 healthy brain and heart packs per month. Take a full dose of breakfast, lunch, and dinner. I weigh 142, and I take a full dose of the healthy brain and heart pack twice a day. I only weigh 142. I weigh about half Okay, a little bit less than half of what you weigh. And so it's one of those things where you have to be heavy-handed here. And then I want you to get 2 bottles a month of the MSM. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they will add to that 215 nutrients in the Healthy Brain and Heart packs. They will add to it collagen. We're talking about cartilage, ligaments, tendons, connective tissue. This can support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And then you need the collagen peptides, more collagen. Okay, so take a scoop of that in your morning drink, take a scoop of that in your evening drink. I do that. The high blood pressure, you want to get 2 bottles a month of the Ultimate Daily Classic tablets, the Ultimate Daily Classic tablets. Take 3 at breakfast, 3 at dinner time. Don't cold turkey off your medication, but as the blood pressure begins to drop, you can slowly reduce the medication based on the numbers. And usually within 2 to 6 weeks, you'll have a miraculous recovery from your blood pressure. I don't care if you've had it for 25 years. Okay. Then also the ADD, I would be eating my 3 eggs twice a day, 3 eggs twice a day. Okay. So with soft yolks, soft poached, soft boiled, soft scrambled in butter. And then you also want to take our Synaptive, take 3 of those twice a day. That'll give your brain the raw materials it needs for the brain cells to make the biochemistry to talk to the neighbor brain cells. And then also we have the, let's see here, we have Memory FX. Go ahead and take 3 of those twice a day. Take the D-stress capsules, capital D like David Stress, take 3 of those twice a day. And then call us every couple of weeks because you're going to have a great story. Your story is very typical of middle-aged men and women in the United States. At 6 foot tall, I'd like to see you weigh, 185 to 210 kind of thing. So you might be 40, 50 pounds overweight. And you'll begin to lose weight when you get off all the bad foods. But if you want to speed it up a little bit, so you're losing a half a pound to 2 pounds a day, you want to replace one meal. You want to replace a meal with our keto shake. Comes in strawberry or chocolate. This is not to add to a meal. This is a meal replacer, and it doesn't have to be the same meal every day. And you can use our Rebounder Sports Drink with 100 nutrients in it. It has 75 minerals and 25 vitamins, amino acids in it. You can take 2 or 3 of those a day. I wouldn't take them after 4 o'clock in the afternoon because you might stay up all night. And so usually within 2 or 3 or 4 months, you'll be down to where you need to be. But then people say, well, how long do I have to stay on all this stuff? Well, how long do you need oxygen, Mike?
Well, yeah, you need it every moment of your life. Yeah.
Yeah. And then how long do you need water, Mike?
You need water to survive.
Okay. How long do you need the 90 essential nutrients?
I would say every day.
Every day, every minute, every hour for the rest of your life. Okay.
But now on the knee surgery there, will this all help with that too? Okay.
You want to prevent the knee surgery. You didn't get the knee surgery yet, did you?
No, I haven't. No.
Okay, good. Give me 90 days. Give me 90 days. And if you do everything as I've explained, you won't want the surgery. And to apologize to the doctor, I'm sorry, I can't, I don't need to put your kids through college anymore.
Okay. Okay.
Okay.
And just follow this protocol for the knee surgery too.
Oh yeah.
Okay.
Yeah, I included that. So that's for the HDH and the MSM and all that kind of stuff came in. Okay.
Well, what about sleep too? I don't need a lot of sleep, but I probably get 6-7 hours a night.
Oh, that's more than enough.
And one last question. My cholesterol, my wife says, should be higher. It's like 126.
Okay. Are you having a happy sex life?
I would have to say at this time, moderate.
Okay. Well, what you want to do is get the Xera test, XERA-test, TEST. Take 3 of those twice a day. Don't forget the 3 eggs twice a day. And, you'll make enough hormones to be chasing a herd of elephants around.
Oh, okay. That sounds very entertaining. Anyway, Dr. Mark, I just appreciate, my wife's been following you and she's a retired pharmacist. So she understands a lot of the things you're saying.
Yeah. And we have a lot of pharmacists who work with us. Some of our top instructors and teachers and and users and business builders in longevity are pharmacists because they know what's going on.
Yeah, she does, definitely. And we're also non-vaxxers. We don't believe in that.
Okay, good. All right.
I do appreciate everything. And Becca, thank you for taking my call. And God bless you all.
Thank you.
God bless you, Vicky and
Absolutely.
Mike.
Yes,
Thank you very
Mike and Vicky, have a fabulous day. And for those of you who are on with us, if you have the chat open, we don't have the option to copy the chat, but you can do a screenshot and capture that information that's being shared in the chat. Mike, I have your protocol there for you. Just do a screenshot and you'll be able to see that. Again, make sure your chat is turned on, folks. Dr. Wallach, let's go to the next hand that is up before our break. Frankie, go ahead and unmute yourself. You are on live with Dr. Wallach.
Hello, how's it going? You hear me?
Yes, sir. Frankie, correct?
Yes,
Oh,
sir.
Okay, how
Hey,
can we
Doc.
help you?
Yeah, thank you for your time, first of all. Let me run down my notepad here. I am 160 pounds, I am 5'10", and I'm 20 years old. In 2018, I was diagnosed with nodular sclerosis, Hodgkin's lymphoma of the
Okay.
intrathoracic lymph nodes. I have a few symptoms of that. This is my third re-diagnosis, third relapse that I'm dealing with. And I've had 2 biopsies of my neck, removal of lymph nodes, a biopsy of bone marrow. I've had radiation treatment on my neck, as you can see. I've had a bone marrow transplant. I've had months of chemotherapy. I wake up at least 2 times to go pee at night. I was born with 1 missing tooth. I've had, I had intermittent asthma when I was 10. I have a history of intense anxiety and depression. And that's what I'm dealing with right now.
Okay. And you weigh 160, correct?
Yes, sir.
Okay. Well, again, do you live at home with your family? Do you live in an apartment with one
Oh, yeah.
roommate? Or
Yeah, I live at home with my family in St. Louis, Missouri, actually. So,
Oh, okay. Yeah. I grew up in a little town outside of Wellston, Missouri.
Mhm.
So, I went to Clayton High School. Got 2.5 degrees from the University of Missouri.
Oh.
And since this is, I'm going to throw one more thing in there, since this is pretty close to the 4th of July. Okay. Fort Leonard Wood, 7 years in artillery, 105, 155 howitzers. Okay. So I'm a big Missouri boy. Okay. So let's see here. I need you to get off all the bad foods, no fried foods, no processed meats, no oils, no glutens. Everybody in the family has got to be totally gluten-free, no wheat, butter, rhinos. So you're not cross-contaminated in food preparation surfaces and the laundries and the beds and the couches and the rugs and all that kind of stuff. Then at 160 pounds, I want you to take 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, full dose everything twice a day. Then I want you to get 2 bottles a month of our MSM. So you take 3 at breakfast, 3 at lunch, dinner time. They're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc, between vertebrae, bone matrix, and bone itself. The bone matrix, also, we're talking about bone marrow. That's where your immune system is to help fight anything, including lymphoma and that kind of stuff. So you want to make your bone marrow happy. And then you need the collagen peptides. They'll do the same thing as more collagen from fish and poultry and sheep and beef. And take a scoop of that in your morning drink, take a scoop in your evening drink. I also want you to take let's see here, vitamin D3, take 3 of those twice a day so you can absorb all this stuff and put them in the right places. Then I do want you to take our Z radical, which is made from seaweed and sea minerals. And it comes in a liquid, tastes very good. Your body weight, 160 pounds. I would start out with a ½ ounce at breakfast, ½ ounce at dinner time. It'll be 1 quart a month. If you should not get diarrhea from that. And it wouldn't hurt also to get a hair analysis. So find out if you have any toxic metals contributing to your problem, or if you're deficient in any nutrients contributing to your problem. And so you want to get a hold of that book, Rare Earths Within Cures, Rare Earths Within Cures. And you will find, let's see here in chapter 10, how to collect a hair, how to package it, where to ship it. Don't forget to put that little check in there, because they won't run the test without the check. And then call us it'll take about 2 weeks to get the information. You'll get two um, screens, if you will. One's going to be for toxic metals, lead, mercury, uranium, and stuff like that. The other table will be for all the nutritional minerals. Are they all below the bottom line? That means you're not absorbing. You've been a naughty boy eating a lot of gluten, okay? If they're scattered all over the place, that's more typical, okay? And you'll find some that are in the good range. You'll find some that are below the good range. You'll find some that are above the good range, and so on. And so we'll make some specific adjustments based on that hair analysis. But if there are toxic metals, we need to deal with that very specifically. Okay, so you got a little homework to do here, and get started. And give us a call every couple of weeks. Give us say, I'm feeling pretty good here. Okay, but everything we've suggested to you is going to support the immune system. All right.
Yes, sir. Thank you. A few more questions as well. With the radiation on my neck, I can feel it's completely like barren. Will my neck ever recover from that radiation?
Maybe 99%. Okay, we have to see, how good you are avoiding the bad foods and taking the 90 essential nutrients. The human body has an enormous capacity to recover, but it does require nutrients to do that, and it does require avoidance of the bad stuff, which interferes with the utilization of the nutrients. Okay, and so you have two things to deal with: get rid of the bad stuff, including gluten. There are no such things as gluten-free oats, and then you have to take. And that's why I always, when people are in your situation, I like the heavy hammer, the healthy brain and heart pack with 215 nutrients, the core of which is still the 90 essential nutrients. But I only weigh 142, and I take 2 healthy brain and heart packs. I pretty much take the program that I just outlined for you, and I only weigh 142 pounds. I'm 83, and I'm not on any prescription drugs. I don't have any health problems. And like I say, I don't have any health problems. I'm not on any prescription drugs. I'm 83 years old. How many 83-year-old people can say that?
Not a lot.
Not a lot.
Also, my oncologist, he has biologics now to offer me, which I am denying. What's your opinion on that?
What's he offering them to you for? What's the purpose?
It's to buffer my immune system. Brentuximab. Apparently they said it has some benefits, but with what they've treated me before, I don't really believe it. Okay.
It wouldn't hurt to get, some status report tests, from an oncologist at the other end of town or at medical school. Okay. And, get a test from somebody else who doesn't have their finger in the pie there.
Yes, sir. Yeah. And one more thing. I've noticed a lot of criticisms, they point out that you yourself, and I don't mean this to be disrespectful, but you yourself, you have gray hair. How would you shut those people up?
Well, let's do an arm wrestling thing. Okay. I have all my own teeth, except one which is knocked out in a fight in a mall. 3 guys tried to take, I was carrying 2 bags in each hand of stuff I had bought. And these 3 guys came and said, give us your bags. I said, go to hell. What do you mean, give me my bags? You gotta be kidding. And so when I had my hands full, this one guy punched me in the face, knocked out 1 tooth. I grabbed him, got him on the ground, and just beating the snot out of him and screaming. And people come running up, and all the other 2 ran away, and so forth. And so, I can still handle myself at 83. I got a letter lettered in wrestling in high school and in University of Missouri. I lettered in football in high school. I was in the Army at Fort Leonard Wood for 7 years, artillery. I was in the Air Force for 20 years, retired as Lieutenant Colonel in the Air Force. I was in war zones many times, and I can tell you that I can handle myself. Okay.
Gotcha. And my problem is completely reversible, yes?
Of course.
Okay. And when I reverse this, I will make headlines, and I hopefully will become a mouthpiece for longevity.
Yeah. Well, you want to become a mouthpiece for humanity.
Amen.
That's where you want to become a mouthpiece for, because you know, there's so many people who by dumb luck stumble into stuff and they do good things and they don't say anything to help other people. So yeah, if you'll, you know, keep in touch with us and keep in touch with, you know, your family, your church mates, if you're a churchgoer, that kind of stuff, your old college classmates and things like that, you know, stay in touch with people and let them know how things are going. Things, you know, aren't all bad. If you do the good stuff, you can come out on top. The odds are you will live longer than your doctor.
All right. Thank you so much, doctor. Thank you so much for your time. It's been an honor
You bet.
talking to you.
Okay, God bless.
God bless you.
Awesome. And Frankie, if I just may add, Dr. Wallach, I have had several people who have had radiation burns from chemo use the Trinity lotion, and using that topically, using that, it's a beta glucan based product that has had great results in helping to help the skin heal after having that.
Yeah. No, we have 5,000 products, and beta glucan. We have hair, skin, and nails. Again, that MSM does a good job with the skin. So does the collagen peptides. And so, you know, when we put together a program for somebody, it's covering the whole umbrella of what may be involved, even if only peripherally and involved. Because if you have symptoms, you know, of any kind, you're not going to be happy. You know, even if you don't die from the lymphoma, but you still have symptoms, you're not going to be happy. Well, yeah, you know, I didn't die from the lymphoma, but, you know, I was really bad for, okay. And so I guarantee you, I had my hair cut just last week, and they showed me this whole pan full of hair. There wasn't one white hair in that pan.
Right. Well, and the nice thing about it, Dr. Wallach, is, you know, the nutrients that are needed for a healthy skin, those are also needed for a healthy digestive system, healthy vascular system.
That's correct.
All of the connective tissue, the tendons, the ligaments, even the muscles.
And, well, the tendons and ligaments are part of the heart valves.
Absolutely. Absolutely. Where everything is connected. And for somebody to take one single nutrient to help one single thing that's going on in their body, for me, just doesn't make sense anymore.
Yeah. And people say that, Miss Rebecca, they say, oh, I take vitamin C every day. Well, what about the other 89?
Right. That's right. We need more than just one, folks. Well, it is break time, Dr. Wallach. I want to thank everybody for joining us here on Ask Doc Live, sponsored by AskDocLive.com. If you are here as a guest and you found this program all on your own, or you are part of the Critical Health newsletter and received an invitation, then I encourage you to go to AskDocLive.com. We have a store there that you are welcome to utilize. And again, this is for the people that have not spoken to anybody about longevity. If you have spoken to somebody about the products, or they referred you to this program, or you've spoken about Dr. Wallach with somebody else, get back with that person that originally introduced you to us. They cared enough, folks, to mention us to you, to help you find resources that will help you in obtaining and maintaining or regaining the optimal health for you. We will be right back after this break. Don't go away. And we are back with Ask Doc Live. My name is Becca Dukes. I am your host for this program, and it is my honor, along with my co-hosts, John T. McCollier, Ruth Ellen Sanchez, Dr. Judy Reynolds, and Heather Bowen, as we bring information to you that can be used as a resource to just make a healthier community, folks. One person at a time. And it's not just one nutrient at a time, though. It's 90 essential nutrients that the body needs, not just to survive, but actually thrive. Now, Dr. Wallach, go ahead and unmute yourself. And
I'm back.
You are back. Yes, you are. Let's go to the next hand that is up, Dr. Wallach.
Okay.
And John, if you would kindly unmute yourself, you are on live with Dr. Wallach.
Dr. Wallach, can you hear me?
Yes, sir.
Good health to you, Dr. Wallach. I've started the program. I think it was time for me to get back to you and let you know what's been taking place for me. Maybe give you a little update.
Okay, where are you from? What?
Okay, I'm living in South Central Missouri right now,
Mm-hmm.
and so that's where I'm at this point.
Okay.
And
So what kind of health problem you have?
okay, just recently, probably last 3 weeks, I believe it's a arthritic hip. I've noticed the pain radiates from my hip pocket, down into the hip.
Mm-hmm.
And then it's also moving towards the front, almost like it's a groin issue.
Mm-hmm.
And the pain was getting pretty continuous. I find that normally I sleep on my back flat. I find if I sleep flat in the morning, I'll have some pain in it.
Okay, stop there for a minute.
Yes, sir.
How old are you, sir?
I'm 68.
Okay, and how much do you weigh?
I weigh 285,
And how tall are you?
6'3".
Okay. And do you have any other issues? High blood pressure, diabetes?
My blood sugar is running between 90 and 115.
Okay, maybe a little pre-diabetic. Okay. What about high blood pressure?
Blood pressure is fine.
Okay. And do you have any other issues? Any heart issues? Any lung issues? Any skin issues?
Really, my focus is really on the hip at this point.
Oh, I understand, but see, they're all related. And for
I
me to do a good job on your hip, I need to know what's going on elsewhere.
Very good. Okay, I have glaucoma. I take medicine for that. Okay, let's see. I do take.
Well, let me ask you a question here. How many times you wake up at night to go urinate?
Maybe once.
How many times you wake up at night to go urinate, take a
Maybe
pee?
once.
Okay. All right. All right. And so have you been to a doctor and complained about this hip issue?
I just went.
And what did the doctor say?
Wanted me to do an X-ray and then an MRI to verify it, if it's hip or not. I asked for an anti-inflammatory, and they gave me naproxen. It seems to have a benefit.
Okay. Did you have a history of any back issues, any back pain or anything like that?
No,
Do you have any ringing in your ears or tinnitus?
no,
Do you have any balance problems or dizziness?
no.
Has your voice changed? Do you have trouble swallowing?
Little trouble swallowing at night.
Okay, when you lay down? Or,
Yes.
Okay. Okay. Are you slowly losing vision?
I do have yes, I have issues with my vision. Yes.
Okay. And let's see here. What about dental stuff? Do you have dentures or do you have your own teeth or?
I've got root canals and I also have implant.
Okay. All right. Okay. Last question. Have you had any of those things, like Bell's palsy,
No,
or one side of your face droops, trigeminal neuralgia, terrible headaches in your temples and behind your eyes and that kind of stuff?
no.
Okay. Yeah, you may have some osteoporosis of the skull going on here that will result in some swallowing issues. This is because the ninth cranial nerve, the glossopharyngeal nerve, when it gets squeezed, causes swallowing problems, change in the voice, vision issues, slow vision issues, can be your skull squeezing the optic nerve, the optic artery, the optic vein, including glaucoma, a little bit of pressure going up in the eye. And then also, when you have, let's see here, when you have dental things going on, just remember the jaw is part of your skull. And so the odds are you have a degree, 1 degree or another of osteoporosis of the skull here. It wouldn't hurt you to get that little book. Okay, it covers 25 different diseases. And of course, Rebecca and I are working on to add one more chapter here.
Yes, sir.
Okay.
I've gotten your book. I've gotten that book.
Oh,
Very
okay, good.
Very good. Yeah.
Okay, well, you need to read it because, you know,
I've
you're a
read it.
candidate.
Yes,
Okay,
sir.
good. Okay, well, here we go. I want you to get rid of all the bad foods. No fried foods, no processed meats, no oils, no glutens, no wheat, rye, rye, and oats. Okay, no sugar, and absolutely no carbonated drinks. I say even the diet one's got to go. And then you weigh 285, correct?
Yes, sir.
At 6'3", I'd like to see you weigh maybe 210, 215, 220. So you might be 60, 40, 50
Makes good
pounds.
sense.
Yeah, overweight. Okay. So I want you to have one meal a day. This is a meal replacer. It's not to add to a meal, but it's a meal replacer.
Yes.
This is our keto shake. It comes in strawberry and chocolate. It's a meal replacer. And then you can have 2 or 3 of our rebound drinks, which is our sports drink with 100 nutrients in it. Most sports drinks are just caffeine and sugar. Okay. Ours are the 100 nutrients in it, 75 minerals and 25 vitamins, amino acids. And you'll lose a half a pound to 2 pounds a day. So realistically, within 3 to 4 months, you should be down to where you need to be. How long do you need to stay on the program? Well, forever. You need, again, if finances are not an issue, I would start out with 3 healthy brain and heart packs a month. If finances are a consideration, don't go any lower than 2 healthy brain and heart packs a month. A full dose of everything twice a day. I want you to get 2 bottles a month of our MSM. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time, and they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between your vertebrae, bone makes bone stuff, including your hip joint, your skull, your vertebrae, and your back. And so you should see a rather quick resolution of the swallowing issue when you lay down at night. Okay, the vision stuff should repair, and so on. And let's see here. I'd also throw in the collagen peptides, a scoop of that in your morning drink, a scoop of that in your evening drink. It wouldn't hurt a big fellow like you. I do this. I only weigh 142, but I also throw in a scoop of the Beyond Osteo FX in my morning drink and my evening drink also. And then see here, it wouldn't hurt also to throw in an anti-inflammatory. We're talking about the Z radical, a liquid. You could take an ounce of that twice a day. That's 2 parts a month. It's seaweed and all kinds of sea vegetables and stuff from the ocean. And if you prefer the capsules, we have the Fucoid Z. You could take 3 of those twice a day. It'll be 2 bottles a month. It's the same thing as the Z radical, but it's capsules instead of liquid. And let's see here. I think we covered everything there. Yes, we did. Yes, we did. Yes, we did. Okay. And so what you want to do is keep in touch with us. Give us a call every week or so, and we'll walk you through this. Okay.
Can I ask you a question?
Yes, sir.
Like I want to do it as optimal. Would it be better if I did liquid over the powders, or what's your opinion?
Okay. You could, use the Z radical.
Okay. Yes.
Okay. Yeah, use the Z radical instead of the Fucoid Z. But those are the add-ons. Okay. The Healthy Brain and Heart Pack. You make it. It comes as a powder, but you turn it into a liquid. Okay, and turn it into a drink. And I take 2 of those drinks, a day. One at breakfast, one at dinner time.
So I should take 3 if I do it the 3 heart pack.
Yeah, if you do it 3, which is for your body weight, because you weigh almost 300 pounds.
That's right.
And it's one drink per 100 pounds of body weight. And that's why I say if finances are not an issue, you want to take 3 of the Healthy Brain and Heart Pack. So you can take a dose at breakfast, lunch, and dinner. But if finances are an issue, don't go any lower than 2.
I will do 3. Yes.
Okay. So yeah, give us a call every couple of weeks. It's going to take a few days, to get the products to you. In Missouri, we have warehouses in Illinois and Missouri and Nebraska and Colorado, so they'll get it to you as quickly as possible. But getting rid of the bad foods, you can start today. What I want you to do is box up all the bad foods, like the sugar and the salad dressings and the gluten and all that kind of stuff, and put a ribbon around it and give it to your doctor with love. To
Yes.
Russia with love. To your doctor with love.
Ask you another question.
Yes, sir. One more.
Okay. I noticed about I have been on this for a while, so I've gotten off the gluten, I've dropped the sugar quite a bit, and so I am on the program. But like I said, I just had the issues with the hip. what I wanted to ask you was, I don't use my salt. I haven't growing up because my mother didn't cook with it much. So I was wondering now, I know that you need to have be able to process the minerals in your stomach. And I know that from what I understand from what you said, you need to take sodium chloride. And I was wondering, should I be doing about I think you had mentioned at one point about a quarter of a tablespoon morning and night. What would you, or?
Okay, well, here's what I would do.
Yes.
We have what we call pink Himalayan salt. It comes from the Himalayan mountains, is where all the oceans dried up and all the minerals and salt kind of collected in the valleys, and we have access to that. And we had it for, we have it every morning for breakfast. We have it every evening for dinner. I only weigh 142, and I take a half a teaspoon of that pink Himalayan salt with my breakfast, and a half a teaspoon of the pink Himalayan salt with dinner time. You don't want just salt, with
I understand. Yeah, no, because it doesn't have the minerals in it. Yes, the Himalayan that's salt. Yes, sir.
Yes. Okay.
Morning and night, 1/2 teaspoon.
Yeah, you want a half a teaspoon.
And then I
to
will
start out.
And I will be doing the hair analysis shortly too. I understand.
Okay, good. Yeah, the hair analysis is always good. Most people should have a hair analysis once a year.
Yes.
Because we want to see if you've been bad during the year, if you've been good, and that'll give you tips on how you need to adjust your program and so forth. And if you're doing this as a business or you own a business, you can write off the hair analysis as part of your healthcare costs stuff, as part of your lab work and stuff like that. Okay.
At this point, my goal is to become you can only lead by example, my friend.
Okay.
Yes.
We look forward to hearing from you, John.
You will, definitely. I appreciate it very much, your time.
Okay, God bless.
Bless you.
All right. Thank you, John.
Rebecca.
So Dr. Wallach, we have something special that we would like to share with you. And Jonty is going to do a screen share. And
okay,
let me know when you're ready, Jonty.
Okay, great. Yeah, hey, Doc and everyone.
There we are. There's the headset.
A little advertising campaign, actually, and I showed Rebecca the video that I'd made, and we thought that the Ask Doc Live folks and well, the whole team might get a kick out of this.
Okay.
You have to promise not to cry, though.
Okay,
I promise I still could talk.
Okay.
Oh, Jonty, you need to share.
Yeah.
Go ahead and stop and then share audio on the next try.
Oh, okay. Did you see the video?
Yep, video showing great. We just can't hear it.
Okay. Here.
You might have, there we go. And then as you do it,
share sound. That will help.
that'll help a lot.
Okay, from the top. Why we love Youngevity. Being part of the Youngevity family gives you the opportunity to run a highly functional, independent, and profitable business. But it isn't about making money. Being a part of the Youngevity family gives you the opportunity to learn how diet and nutrition heal or hurt the human body. But it's not about health. Being a part of the Youngevity family is about a grandmother embracing her grandchild. It's about a retired runner returning to the track. It's about 50th wedding anniversaries. It's about standing up straight for the first time in years. It's about a beautiful, healthy baby with their whole life ahead of them. It's about sharing a sunset. It's about a Thanksgiving dinner with one less empty seat. It's not a reason why you need to get up in the morning. It's a reason you can't stay in bed. It's a meaning that calls you to action. Sign up below to join our uniquely skilled, motivated, and connected team on this journey. I'll spare you the outro.
Oh, that's beautiful. Very well done.
So
wonderful.
I I absolutely love that because, you know, there are so many things in life that we don't think about until they're gone.
Hmm.
So I just want everybody to take this moment and really embrace everything that you have to be thankful for, and think about what can you do as an empowered individual to help more around you be able to continue being there for you to be grateful for. So now I'm going to cry. Let's go to so we have a question here, and the next person, I'm going to ask her if she would please raise her hand. But let's go to Jeff. Jeff sent in a chat message, and I thank you, Jeff, for raising your hand, as he has somebody that he cares about that he would like to ask you a question. So Jeff, go ahead and unmute yourself.
Can you hear me?
Yes, sir. Go ahead.
Oh, you guys are awesome, and I'm gonna cry from the last video. And Dr. Wallach,
Wasn't that great? Yeah.
You are Dr. Wallach. You should have a whole bunch of Nobel Prizes to your name.
Well, we have a team. That's for sure.
But, you were the first person to introduce me to health so many years ago, and just thank you so much. Dead Doctors Don't Lie on cassette, and thank you, thank you, thank you.
You're very welcome. How can we help you today?
My mom is dealing with some issues, and the main issue she's dealing with is MDS, which is basically her bone marrow has stopped making red blood cells and white blood cells, platelets. So she has to go get a transfusion every few weeks or so. She's on transfusion number 6 or 7. She, we've done the holistic, tried to go the holistic route. She doesn't take any medication.
How much does she weigh? How much does your mom weigh?
140, and she's 5'5".
And how old is she?
85.
Okay, so she's about my age. Okay, all right. Yeah. Okay, now when people from anywhere from teenagers to middle-aged to seniors like your mom have to get regular transfusions, that means their bone marrow is not working. The bone marrow is not, making red blood cells and white blood cells and platelets. Did she ever get hemorrhages under her skin and stuff like that?
No.
Okay.
She does have a hip replacement, so she's had joint issues. She's had back issues. She's had bladder issues. She has 2 slings installed.
Okay. Does she ever complain about getting up at night to urinate?
Well, she has issues with urination throughout the day. So I mean,
okay. So every hour she's urinating, kind of thing.
Yeah.
Okay. She has osteoporosis of the skull. Does she ever complain about balance problems or vertigo, dizziness?
Yeah, a little bit.
Okay. Does she ever complain about ringing in her ears or noises in her ears?
Not so much that. Weakness in her legs.
Okay.
Spinal issues, definitely.
Okay. Well, here we go. Yeah, she needs to get a hold of that book. It's All in Your Head. Okay. And read that book. And here's where Rebecca can guide you in that direction and how to get that book. And it goes into 25 different diseases, including many of which your mom has. Okay. These things are not genetic. They're not due to age. They're due to very specific nutritional deficiencies. And she's got many, okay? Many of these issues.
Can I add one thing, Doctor? We had a hunch that maybe she was getting some toxic metals through her well water. So did a urine test, and she was 400 on us for strontium.
Okay, what she needs to do is get a hair analysis as opposed to, get a hair analysis. Go to the book, Rare Earths Been Cures, chapter 10, and get her a hair analysis. And that'll give us, all her essential minerals, all her toxic minerals and everything. That'll give us a real sense of what's going on there. Okay. Okay, well, here we go. In addition to that hair analysis, at 140 pounds, we wanted to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no butter, rye, and oats, no sugar, no carbonated drinks. The diet one's got to go. And then, because of her various things going on here, wanted her to have 2 healthy brain and heart packs per month, a full dose of everything twice a day. Okay, the healthy brain and heart packs has 215 nutrients in each one. Okay, then I wanted to have 2 bottles a month of the MSM, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc, vertebrae, bone matrix, bone itself, and bone marrow. So she can make more red blood cells, more white blood cells, more platelets, but also rebuild her skull. Okay, help rebuild her skull, which is putting pressure on these cranial nerves, and also the joints, her back, and vertebrae, and hips, and all that kind of stuff. Okay, and then let's see here. And if I didn't say it, the collagen peptides, a scoop in her morning drink twice a day. Let's see here. I also want her to have, at her age, I want her to have the Xerafem. Okay, she can get 1 bottle a month of Xerafem. She can take 3 of those a day, 1 at breakfast, 1 at lunch, 1 at dinner time. And Xerafem, XERA-FEM, gives her the raw materials for her ovaries to make female hormones. And even though she's not going to, be expected to run around, have a wild sex life, but basically what's going to happen here is even women who are 100 years old do better if they're making their sex hormones. Okay. And so she needs to also be taking her body weight, 3 eggs twice a day with soft yolks, because female hormones and male hormones both are 95% by weight cholesterol. She does need the eggs. She cannot be on statin drugs to lower cholesterol. They got to go if she's on them. Okay. And then let's see here. The white blood cell count should normalize, or the red blood cell count should normalize. And so she shouldn't have to have transfusions on a regular basis anymore. And we do this, gosh, I don't know how many hundreds of times a day around the world, because this is a very common thing that happens to older people if they're not getting all the nutrients and they're eating bad stuff. Okay, so let's go here, and then give us a report every couple of weeks. Okay.
Sounds good. Thank you.
Okay, Jeff. God bless. Give Mom a hug for us.
You as well. Thank you so much, Doctor. Can I? I didn't plan on doing this, but would you mind dealing with some issues that I have?
Okay. Let's see here. That's up to Rebecca. If Rebecca
Yes.
has this. Okay. Go for it.
Awesome. Thank you so much. So I'm dealing with prostate issues. PSA number is slightly elevated, at an 8.
Okay, how much you weigh?
165. I'm 5'10". I'm 60 years old.
Okay, how many times a night do you wake up to go urinate?
Not too often, maybe once, and a lot of times none. But I do have retention of urine in the bladder, so I do have bladder issues.
Okay, well, the bladder issues are controlled by spinal nerves. And when you have osteoporosis of the skull, it squeezes the spinal cord, which then shows up in all these peripheral neuropathies. You get numbness and tingling in the toes and feet and hammer toes and trigger fingers and carpal tunnel syndrome and all that kind of stuff. Low back issues, sciatica, and also a failure to fully empty the urinary bladder. That's not a prostate issue. That is the nerves that are being squeezed. Okay. Doctors like to blame it on a prostate issue, but it happens in women actually more frequently than it does in men, because women have osteoporosis at 4 times the rate that men do. And women don't have prostate glands. So I learned a long time ago that these issues, although doctors want you to come in and do biopsies and all that kind of stuff, that's how they put their kid through college. Okay.
Sure.
But the odds are it's not a prostate issue. But if you want to add something to your program, are you already taking our products or not?
I'm not.
Okay. Stop. Then what you want to do is take 2 healthy brain and heart packs per month, a full dose thing twice a day, 2 bottles a month of the MSM, so you can take 3 with breakfast, 3 with lunch, 3 at dinner time. You want to take, that's going to help with all your bones and ligaments and tendons and connective tissue. We take 1 scoop of the collagen peptides at breakfast, 1 scoop of the collagen peptides at dinner time. Vitamin D3, 3 of those twice a day. That's 2 bottles a month to absorb the minerals and put them in the correct places. And then if you want to, you can get 2 bottles a month of our Xera test, XERA-TEST. Take 3 of those at breakfast or dinner time for making male hormones for the Sertoli cells and testicles. And then be sure that you're getting 3 eggs twice a day so you can get the cholesterol, because testosterone in males is 95% cholesterol. You cannot be on statin drugs. You cannot be on statin drugs. You cannot be on statin drugs. Okay. If you already bought some statin drugs or doctors prescribed them for you, want to box them up, put them in a beautiful ribbon, and give them to the doctor with love.
Thank you so much,
Okay.
Doctor.
Okay. God bless you, sir. And let's hear from you for yourself and your mom every
Thank
couple of
you.
weeks. Okay.
God
God
bless you.
bless.
Thank you. Thank you.
Thank you.
All right,
Oh.
thank you so much, Jeff. So Dr. Wallach, one thing that I would like to do, and I get this question quite often, is how do you take the Beyond Tangy Tangerine and the Osteo FX? And I would like to just do a quick little tutorial on that. And because of where I'm at, I don't have all my products with me in this room, but I've got a bottle. I do it about, 3/4 of the way full with water. And I do like to use clean water, not something that's been chlorinated or fluoridized. And then it's 1 scoop of the Beyond Tangy Tangerine and 1 scoop of the Osteo FX. Now, we did have some scoop size changes in our manufacturing process, so you might do 2 scoops if you have the little domed bottom scoop in your Beyond Tangy Tangerine. But you put them together. We even mix the collagen peptides, mix that in there.
That's correct.
I've put Z-Radical in here. And many times I'll drink it down a little bit and then I'll top it back up with water and just drink it throughout the day. I'll even add in my plant-derived minerals, a good splash. And for those of you who don't know, on the top of that bottle of the plant-derived minerals are 32-ounce bottles of the plant-derived minerals, the cherry mints, the strawberry kiwi mints. That cap measures 2 tablespoons, which is equivalent to 1 ounce. So I don't know if everybody knows that, but they've made it so simple to be able to figure out how much is needed. And that 1 ounce is needed and sufficient for 100 pounds of body weight. So if you're 150, do a cap and a half. If you're 2, do 2 caps per day. And you can mix it in with water in the morning, drink it, mix it in the afternoon, drink it. I seldom drink water without there being minerals in it because I just want to keep that mineral flowing. My body doesn't need it just in the morning, it needs it throughout the day. And with the minerals, I find, Dr. Wallach, it helps me have more energy throughout the day. I feel great. There's just so many benefits to it. I don't want to stop, but
Well, you get an A+, dear.
maybe it's a new addiction. But hey, if anybody wants to have, some type of support system, we've got a support system for this addiction. And as John T's video proclaimed, we are a community, we are a family, and it's all about helping and supporting each and every one of us to be the best that we possibly can. So
Yeah, and it takes stuff to do it. And Rebecca, really, she is, what should I say? She's a perfect trainer. She trains everybody how to make sure you're taking it easily every day. Again, I've been doing it for 75 years, twice a day. And so I'm 83 years old. I don't have any, I'm not on any medication. I don't have any diseases of any kind. And so, think about it, 83 years old, no heart disease, no kidney disease, no lung disease, no intestinal diseases, no joint stuff. I don't have anything going on from the standpoint of, osteoporosis from old age and that kind of thing. I don't have any muscle problems. I'm extremely strong. And I'm not on any prescription drugs of any kind. And so, how good does that get? just think of the enormous amount of misery I've avoided. Just think of the enormous amount of money I've saved by taking these nutrients twice a day. And it's one of those things where I guess Rebecca and I are living examples of really how to make your life worthwhile. I mean, 25 to 50 extra years with the people you love, is that good? That is good.
That's great, Dr. Wallach. And so we have two examples here. We have Dr. Wallach that's been doing it all of his life. We have myself. I'm in my 50s now, and I wasn't doing it all my life. I didn't find Dr. Wallach until 7 years ago. And at that time, I was on so many different pharmaceuticals. I was looking at, well, I had broken my back. They wanted to do surgery. I had herniated discs. They wanted to do surgery. I had overgrowth of calcium on the back sides of my knees. I had fibromyalgia, metabolic syndrome, and migraines that I had been experiencing since I was 8. And now I have none of that. And I've lost 100 pounds. So.
And you look like you're 35.
It's been a win-win, Dr. Wallach, and it wasn't too late for me. And folks, it's not too late for you.
Okay, the only time it's too late is when you're in the box, when you're in the coffin.
Yeah, when you're not taking in that oxygen anymore, that's when it's too late. So,
yeah. And so if you're still alive, even if you're in bed with an IV going, it's not too late.
That's right. That's right.
In fact, let me tell you one story, if I may, real quickly here.
Real quick.
Okay, this came up with a CD and a DVD set we call Praise the Lord and Pass the 90. And this is about Pastor Mike Freeman up in Baltimore, Maryland. He was in a coma for 6 months in a hospital up in Baltimore, Maryland. And the doctors told his wife and one of our great distributors up there, Miss Linda, that he only had a couple of days to live, that, the end had come, not much they could do of any kind. And so they called me and said, is there anything we can do for him? I said, well, does he have a G tube where he can put some nutrients into his G tube? No. I said, okay, well, just take some plant minerals and take a cupful and rub it on his chest and his belly every couple of hours, and take another cupful and rub it on his upper back and his lower back every couple of hours. And in 3 days' time, he wakes up, shaves, gets dressed, and goes back to the church. And this had to be about 10 years ago now. And he went into the studio, and he started on his TV and radio and started telling the world his experience. And so I flew out there and he interviewed me. And that interview is on that CD and DVD set called Praise the Lord and Pass the 90, because we're going to give the Lord all the credit. Okay. But here's a case where the doctors had given up on him. Okay. And we just rubbed the minerals on his body and skin, and he was able to absorb enough minerals through his skin, the liquid minerals, that it pulled him out of this downward death spiral in this coma that he'd been in for 6 months in just 3 days. Now, I don't know how to say it any better than that. When the end is coming, the doctor said, that's it, game over. If we just rub these plant minerals on his skin, he absorbs them through the skin. And here he is 10 years later, he's preaching the gospel, praise the Lord and pass the 90. If you've been in the military, you know what that means. During a battle, when you have enemies shooting at you, you want God on your side, and so you praise the Lord and thank him and pray to him. But also you want to pass the ammunition. Praise the Lord and pass the ammunition was our watchword in battle. But now, when you're dealing with God, you want to say, praise the Lord and pass the 90.
Well, and that, Dr. Wallach, that just goes to prove that there is a great physician, and not all physicians know the time of your death. So we want to prove them all wrong.
There you go.
Dr. Wallach. Well, our next person that we have here live with us is Vanessa. So Vanessa, if you could go ahead and, oh, wait a minute. Yeah. Unmute yourself. There we go.
Okay. Hi, how are you guys?
Hi.
Okay, so I've been listening to Dr. Wallach for quite a few years now, and so I thought I would join in on your Zoom today and see if I could get a couple of questions asked.
Okay.
Backstory, I retired from the Army in 2012.
Thank you for your service.
Thank you.
Wow.
But I only said that to say this. 2 years after I retired, which I had never had any issues there or anything. In 2014, I had a TIA. And so they put me on blood pressure meds and 325 milligrams of aspirin, which I took for years and with no issues. So in 2019, around November-ish, I decided to go down to an 81 milligram because I thought I was doing so well. And then in June of 2020, I had a 3 millimeter infarct stroke. It's called a lacunar infarct stroke. And so they put me on these cholesterol meds, atorvastatin, 40 milligrams. And then after that, you know, I started, a few months later, I started feeling kind of awkward and weird and everything. So last May, my tongue started swelling out of the clear blue. So the doctor took me off of the losartan and put me on a variety of different types of blood pressure medicines. And I think they were too strong because they were making me really dizzy and lightheaded. So now I'm taking labetalol, 100 milligrams, which they let me cut it in half.
What's that for?
For blood pressure.
Okay.
And then I'm not sure if it's the blood pressure or the atorvastatin, which they moved my atorvastatin down to 20 milligrams because I'm having muscle spasms a little bit in my legs.
Okay, enough.
Okay.
Do you have any other issues like constipation, diarrhea, lung problems, asthma, bronchitis?
No.
Do you have any dizziness or vertigo?
Yes, and that's what I'm trying to figure out if that's from the stroke or from the medications, because I didn't have it before these two medications.
Okay, stop. Do you have any, let's see here. Do you have any ringing in your ears, any tinnitus or ringing in your ears?
I think so. Sometimes my ear, it feels like one of my ears kind of goes dim a little bit. And then after a while, it kind of gets back to normal.
Okay. And let's see here. You're not on dialysis?
No, my kidney functions are fine. My liver is good.
What about diabetes?
No, my A1C was up a little higher this time when I took my labs.
How high was it?
Well, it was a 6.5, but I normally run a 5.9, 5.8, 5.7, never above a 6.
Okay. And then let's see here. Lastly, how much do you weigh?
I weigh about 114, 15.
And what was your duties in the military?
I was a mechanic. And then, you know, as I grew in the military, maintenance supervisor.
Okay, congratulations. Okay, well, here we go. You need to get rid of all the bad stuff out of your diet. Okay, no fried foods, no air frying, no deep frying, no pan frying. Okay, no frying. Absolutely no processed meats of any kind. Absolutely no, let's see here. Absolutely no oils, no cooking oils, no salad dressing, none of that kind of stuff. Okay. And then you also need to stay away from gluten, no wheat, no barley, rye, and oats. You want to live like an Asian, live on rice and sweet potatoes, that kind of thing. Okay.
So
and
no
then,
steel cut oats, huh?
Oh, no. You want to die early? You're going to die early if you eat steel cut oats.
Oh,
Okay.
I eat those quite regularly.
Just give it to your doctor.
Okay.
Okay. Give it to your doctor. Say, I love you, doctor. So I'm going to give you all my steel cut oats.
Okay.
Okay. He'll know what's happening. And then you need to, let's see here, stay away from, like I say, the wheat, the barley, rye, the oats. And then you want to stay away from carbonated drinks. Even the diet ones got to go because the carbonation of the diet drinks will neutralize your stomach acid, so you cannot efficiently absorb minerals and digest food. You want that stomach acid. I do want you to use our pink Himalayan salt. It has 72 minerals in it, okay, as well as the sodium chloride. And as the name implies, it comes from the Himalayan mountains. And when the oceans all dried up thousands of years ago, all the salt and all the minerals and everything that was in that seawater just built up. The water evaporated, but the minerals stayed there. So that's where we get our pink Himalayan salt from.
Okay.
And then, okay, I think that covers staying away from all the bad stuff. Then at 114 pounds, correct?
Yes.
Okay, one healthy brain and heart pack per month. That's our big hammer. It has 215 nutrients in it. I want you to get an extra bottle of our selenium with the 5 cofactors in it, not from Walgreens, but our selenium. There's one bottle of selenium comes in that healthy brain and heart pack, but I want you to take 3 twice a day. So you need to get another one of our bottles of selenium with the 5 cofactors in it. And then I want you to get 2 bottles a month of our MSM. So you can take 3 at breakfast, 3 at lunch, or dinner time, and they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes the bone itself, including the skull, the vertebrae, and the tongue thing happening may have to do with the 9th cranial nerve being squeezed. It's called the glossopharyngeal nerve. It'll also affect your voice and swallowing ability. It may accumulate mucus and trying to clear your throat all the time kind of thing. That's the 9th cranial nerve being impinged upon. Okay. And so then I also want you to have, for the high blood pressure issues, I want you to take our 2 bottles a month of our Ultimate Daily Classic tablets, take 3 twice a day. They will support and promote healthy blood pressure and healthy blood flow through blocked arteries. And that's also going to prevent more TIAs, transient ischemic attacks. Okay, it'll prevent more of those. Let's see here. And don't cold turkey off your statin drugs or anything like that. But as you know, the lab work shows you'll be able to withdraw off of that. So I think everything else is fine to start with, but do give us a call every couple of weeks. It's going to take, what state are you in?
I'm in North Carolina. So would that take
Okay.
away the dizziness? Will all the dizziness kind of go away as well?
Yeah, well, the dizziness, you need to get this book there.
It's all about the brain,
Yeah, it's called It's All in Your Head.
all in
Is
your
the name of the
head.
book. It's All in Your Head. And of
Okay.
course, you were in the Army, right?
I was, yes, I retired, yes.
Okay, now I was in the Army for 7 years, Fort Leonard Wood, 105s, 155s.
Okay, okay.
Howitzers. Okay. And so I did retire as Lieutenant Colonel in the Air Force. So I'm a military
right.
person. So I appreciate
right.
all that you do.
And thank you for what you did as well.
Okay, thank you. And so you will be amazed. You're going to be amazed because that dizziness will go away. So that tells me, see, when you have that dizziness, okay, it's called vertigo, and it
Right.
goes along with the 9th cranial nerve being squeezed. It's actually the 8th cranial nerve. It's the vestibular branch of the 8th cranial nerve being squeezed, so that you definitely have osteoporosis of the skull. There's 25 different diseases you can get when you have osteoporosis of the skull, and you have at least 2 of them. Okay, you see them all listed on the cover here. Rebecca and I are adding one more. We're adding one more chapter to the book. Okay. And so it will be very revealing to you. And, you know, you go to your meetings and stuff like that, and you want to share that information with other people, because believe me, you're not the only one who gets these problems. This is very common. And doctors never talk about osteoporosis of the skull, because when you have osteoporosis of the skull and they just treat the symptoms, you're putting their kids through college. You're paying for their kids to go to college.
Right.
Why not
And
get
see,
rid of the problem?
And see, I thought that I was probably having those strokes. My father has had a few strokes. So I'm thinking that, you know, it's kind of
Not genetic. Not genetic. Nope.
Okay,
nope,
that's
nope.
good to hear.
Okay,
That's
nope.
good to hear.
It's all nutritional deficiencies.
Okay,
Okay.
and so Becca, can you send me the list? Because he's talking so fast, I couldn't write it all down, please.
Yes, actually, if you go to the chat, open up the chat, you can do a screenshot. I put that in the chat for you.
Oh, you did?
I
Okay.
did.
Oh, I see it. I see it. Thank you. I didn't look at it yet. Thank you guys so much. I appreciate it.
We
are
love
very
you,
welcome.
appreciate
Love you
you.
too. And you guys, everyone have a great day today and a great weekend.
Yeah, the 4th, thank you for your service.
And thank you for yours as well. And for everyone else who have done service time.
Okay.
Thanks.
Okay, thank you. Okay, Rebecca, we got time for one more?
Absolutely. We have time for one more. And everybody, you can find Dr. Wallach's books at askdoclive.com. We do have a menu option there that says Dr. Wallach's books, and you'll be able to find his most popular books there and make a purchase. So Dr. Wallach, let's go to the next hand that is up, and let me just make sure I have these in order here. Let's see if we can fit 2 in. TC, go ahead and unmute yourself. You're on live with Doc Wallach, and if you're able to turn a camera on, that would be fabulous also, but I see you do not have a camera, so disregard. What can Dr. Wallach do for you today, TC? Uh-oh.
Uh-oh.
TC, we're not able to hear you, my dear. All right, let's go to Pauline. Pauline, go ahead and unmute yourself if you would, please.
Thank you very much. Good afternoon. I'm just checking to see if the doc has any recommendations or suggestions for tinnitus. I do have that. And I find that it sometimes is a little bit worse than others. Sometimes it
Okay.
keeps me awake.
Okay, Pauline, how
Yes,
old are you?
I will be 59 in a couple of days.
Okay. Do you have any other issues? Do you have any vertigo or balance problems?
I do have, I think, a little bit of a vertigo. It's, sometimes I do stand that I feel a little bit kind of wave.
Okay.
I'm
And do you have any
assuming that might be it. Yes.
you have osteoporosis of the skull. Tinnitus or tinnitus, however you want to pronounce it, is actually a squeezing of the auditory branch of the eighth cranial nerve. The vertigo is a squeezing of the vestibular branch of the eighth cranial nerve. And have you ever had Bell's palsy or trigeminal neuralgia or anything like that?
No.
Have you lost your sense of smell?
No.
Do you have anything going on in your neck or your back, your arms, knees, hips?
In my neck, there is a bit of a stiffness. And just in recent time, I do hear a little bit of a clicking going on there.
Okay.
I take a high amlodipine. I do 5 mg, just one in the morning.
Okay. How much do you weigh?
128.8. So 120.
Okay. What about diabetes or high blood pressure?
Well, high blood pressure, yes, that's the amlodipine, but not aware of any other diseases.
Okay. All right. Well, you have osteoporosis of the skull, and you're a perfect candidate again to get this book. Okay.
Yeah.
It has nothing to do with age, but doctors forget when you have osteoporosis of your left knee, you got it in every bone in your body. Okay.
Mhm.
It's not just your left knee. Okay. And so they forget that. And I waggle my finger at them for that. And so, I want you to get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, no butter, rhinos, no sugar, no carbonated drinks. I do want you to, 120 pounds is right at that cusp. Let's go with one healthy brand.
128.
Okay, 128. We'll give you
Yes.
credit for that 8 pounds. Okay. Okay, so one healthy brain and heart pack per month, a half a dose of everything twice a day. I do want you to get another bottle of our selenium with the 5 cofactors, not from Walgreens, but our selenium with the 5 cofactors. So you can take 3 twice a day, because one bottle of our selenium will come with the healthy brain and heart pack. I want you to get 2 healthy, let's see here, excuse me, 2 bottles of the MSM, 2 bottles of the MSM. So you can take 3 at breakfast, 3 at lunch, 3 at dinner time, and they will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between your vertebrae, bone matrix, bone itself, and including the skull. Okay. And then I want you to get our collagen peptides, take a scoop of that with your morning drink and a scoop of that with your evening drink. I do want you to take our Ultimate Daily Classic tablets, get 2 bottles a month of that. So you can take 3 twice a day. That'll support healthy blood flow through blocked arteries, and also to support healthy blood pressure. I do want you to notice, because you're the tinnitus, the ringing in the ears, the vertigo is going to go away, because it's a very simple nutritional deficiency problem. Okay. And the neck stuff with the vertebrae and the disc and everything, that'll all repair here. Don't forget vitamin D3, 2 bottles of that, because they're small bottles, 2 bottles of the vitamin D3. So you can take 3 twice a day to absorb the nutrients, particularly the minerals, and put them in the right place. And so give us a call every couple of weeks and give us a status report, and we'll walk you through this. Okay, Pauline?
Okay, thank you.
Okay,
Thanks,
God bless.
Okay, God bless you.
All right, Dr. Wallach. Well, I cannot believe that we are at the top of the hour again. Everybody, thank you so much for joining us here on Ask Doc Live. For those of you who have referred somebody to our program and shared our program with others, thank you, because they're going to thank you as well. You are doing your part in helping to create healthier families, healthier communities, and a healthier world. And the information that you're getting at on this program, they're not going to find anywhere else. So special thank you for doing that. And with it being in the United States, 4th of July weekend coming up, we do want to salute and give our thanks to everybody who has served in the armed forces, and not just those that have served in the armed forces, but their families who have supported them. It's not just them. You're part of that as well. But they did. Some gave some gave all. And because of our armed forces here in the United States, we have an independence that we do not want to let go of. So thank you for those of you who are here with us in the States. Happy 4th of July weekend. Have a great and safe weekend. And remember what it's all about. It's not about going out and partying and boozing. It's about giving thanks and being thankful for the independence that we have in our lives, our country. So, Dr. Wallach, thank you for your service. And
Okay, well,
my
thank you for all
father
you do.
his service. And if he wouldn't have come home, then I wouldn't have been born. So I appreciate everybody that has gone and been in battle and made it home. And, you know, there's so much that we can do for our loved ones, because the effects of war are not to be overlooked. And nutritionally, that also can be supported in helping them be the best that they can be, both mentally, physically, and emotionally. So, Dr. Wallach, thank you.
Well, God
My
bless you,
team-
and thank you for you and your team.
My team, Heather Bowen, Dr. Judy Reynolds, John T. McCollier, Ruth Ellen Sanchez, thank you so much for being a support and helping make this program go smoothly. And for all of you who joined us today, you're why we do this. We want to make sure that you have the resources that you need in order to, again, be the best that you can be. Everybody, this is Ask Doc Live. If you have never spoken to anybody about longevity and you would like to speak with somebody, you can go to askdoclive.com and use the contact us option. You send us an email, one of our certified holistic health coaches will get back with you, or we do have a call team standing by at 855-949-7234. Again, my name is Becca Dukes, and it's my honor to host this program for you. Bye for now.